When we've engaged the diaspora, we try to understand, first of all, what the interests of the diaspora is and how can we facilitate that interest and align it to the government and what is it that the government want. And I often said this many times, that while the interest of the diaspora is one thing, it is very crucial for the diaspora to understand what the government's interest is, because the government interest will be fueled by their budget. That's where the funding are going to go to, so they can spend on whatever they need to do to take the country to a particular direction. So when the diaspora has an interest, it's better to fit that interest into a sector or into a government program that will help you to get that done. Let me give you an example. I always use the Ministry of Health back home in Guyana as our poster ministry, or as the way we want diaspora engagement to work. What do I mean by that? The Ministry of Education, Health, and again, it's just one. There are many, many other good ministries that have a really good program. The Ministry of Health understands what they are doing, what their mandates are. They understand hospital construction, they're doing, they want to do medical tourism, they understand the need for skilled laborers to fill those positions that will be created as a result of the numerous hospitals that are going on. So whenever a diaspora comes to us and says, we have a program, we want to donate something in the medical field, we have skills that we want to bring in, or we want to contribute one way or the other, we now engage, the diaspora engages the Ministry of Health to say, okay, we have an interest from the diaspora, where does this person fit into your entire scheme of thing? And then we facilitate meetings with the diaspora, the interest in diaspora, and an official from the Ministry of Health. They always walk away with satisfaction that their interest is actually going to be dealt with. Because the Ministry of Health understands where to fit them. It's kind of like a big jigsaw puzzle. So okay, we're building hospitals, we're gonna need lots of laborers or skills in the different areas, doctors, support agencies, and all of that, basically. We need to digitalize records, we know where this person's gonna fit. We need donation, we know what donation is actually gonna be needed. We have healthcare centers across the country, what role you can play in that. We have medical missions that come in from the diaspora, and they want to assist, so we collaborate with the Ministry of Health, and they know how to facilitate and to help that medical mission that's coming in there, perfectly run. And that's the model we want to actually do for all the other ministries, basically. And so we've been working behind the scenes to put a lot of measures and mechanisms in place, the logistics, to create that environment where it fosters, an easy transition between diaspora and that there.